Hi, everyone. I have no idea if anybody's watching this. This is a first, and from here on out, we're going to put these on YouTube so they're documented and saved somewhere. I'll post some pictures and things as we go, but I'm going to have to kind of learn as we're going. This is new to me. If you guys have any tips, please feel free to, message me or put them in the comments. My name is Ellie Gettinger. I'm the Education Director at Jewish Museum Milwaukee. And normally when I like to tell a story, I like to have an object behind me. I like to, frame it in terms of its context in our broader museum stories. But I can't really do that and reach out to any people right now. So this is my way of sharing the stories that we tell in Jewish Museum Milwaukee with you guys. Today, I wanted to start with some pieces that we had from an exhibit a couple of years ago. And the exhibit was called Exclusionary Measures. It was about Mount Sinai Hospital and Brynwood Country Club. Both of these things were founded in the early part of the 20th century because Jews weren't allowed in a lot of entities. So Mount Sinai in particular was founded because Jewish doctors didn't have a place to practice. And when you think about the names of a lot of hospitals, not just in Milwaukee, but all over the country, it's, places like St. Luke's, St. Joe's, and these were all affiliated with church groups. And so this was a way of giving Jewish doctors a hospital system that was outside of any sort of church. One of the big things that comes out of Mount Sinai is this sense of having to help or needing to help the Jewish immigrant populations in areas all over the country. So as you start thinking about hospital names, and clearly they're all in the news right now, places like Cedars of Sinai or now I'm blanking on them. There are Jewish hospitals all over the country. And one of the big needs that they were responding to was not just the immediate need of the doctors, but also the needs of these new immigrants and trying to forestall public health emergencies. As we know, when there is a public health emergency, immigrants and migrants tend to be some of the first people who are blamed for these issues. So this was a way for the Jewish community to say, okay, we know that there are a lot of Jewish immigrants in Milwaukee, and we're going to make sure we're taking care of their health. Initially, the nurses who were working in the hospital were trained and staffed from a place called Trinity Hospital. And at some point, especially around World War I, there was a real shortage of nurses, and they needed to ensure that they were getting their own nurses and they were being trained in Mount Sinai. So they started a nursing program in 1914. And it's kind of an amazing thing to think about, that you're starting a nursing program in the middle of World War I. Part of the need for that nursing program is the fact that World War I is happening. So they start this program and then they start training their nurses. And very soon thereafter, there's some urgent public health needs, not just in terms of World War I, but also in terms of Spanish flu and tuberculosis. And while Mount Sinai was originally designed to have a hospital setting where people are coming in, it was discovered very quickly that having everyone head into the hospital when they're sick is a terrible idea. And so what they started doing instead was they started sending their nurses out. They called them the Visiting Nurses Association. This was a massive public health response all over the country. But in Milwaukee, these women would go out into potentially infected populations and respond to the needs to keep them away from other people. So in essence, practicing a quarantine and saving bigger populations. It really is one of those stories that, what we're in the middle of is something that people were experiencing 100 years ago as well with the Spanish flu outbreak. And that it's one of those things we have to be patient through. We have to trust our healthcare professionals, and we have to look at these kinds of responsible examples to get a sense of what's going on in the world and how to make sense of where we are as compared to what happened. On Tuesdays, Thursdays, Fridays at 2. I plan on going through a lot of different stories that we tell in the museum. So if you guys have things or share them, I know that Golda Meir is on my radar. I know the Settlement Cookbook is definitely up there. I plan on doing some things probably on the Hollywood blacklist for anyone who knows me. So keep me posted on what you'd like to hear about, and I look forward to see you guys here again, potentially Thursday at 2 o'clock. Thanks.